Well, welcome everybody. My name is Suzanne Morin and I work at Sun Life. And I'm also a member of the steering committee of Canon and delighted to be participating in Canon and participating in this great first mini summit on COVID that Canon has launched. So we had an excellent overview with Dan and Pollyanna on the different contact tracing apps and considerations. And so thank you, Khaled, Dan, and Pollyanna for that. I've noticed from the participant list, we've got participants literally from all over and all disciplines, from the private sector, from legal, the health sector and providers, governments, different levels and different departments, civil society, not-for-profit, and obviously academics. And so I'm truly honored today to be moderating this panel with two fabulous academics and who in their own right have truly become experts on a lot of the key issues around COVID-19 and the privacy and other considerations around managing that pandemic. From South Korea, join me in welcoming Professor Haksoo Ko, who is from the Seoul National University School of Law. From Canada, we have Professor Teresa Scassa from the University of Ottawa Faculty of Law. So welcome, Teresa and Haksoo. Before we jump into our session for the next hour or 50 minutes, you know, it really was a great overview. And maybe what I might start with is, Teresa, to ask you, because, you know, in the conversations we had in prepping for this, you kept coming back always to government objectives and how that ends, you know, at the end of the day, how that sort of needs to be your shining star. What are the objectives? And so having listened to what we heard before we jump into, you know, the four areas we want to explore today, you know, can you maybe talk a little bit about why that is so important and why that needs to really be the focus?
Yeah, well, I mean, I think a lot of the things we use to measure contact tracing apps, whether it's effectiveness or the adequacy of privacy protection, or or other factors, really depends on what the government is trying to do. What's their goal? What's their objective? And I think sometimes that's not sufficiently clear. So there's also a transparency dimension to that as well. And it might seem obvious that the government's goal is to support contact tracing, and that certainly is typically one of the objectives of adopting a contact tracing app. So supporting the public health authorities with respect to contact tracing activities, right? So presumably if it's a contact tracing app, that's one of the goals. But there may be other goals as well. And another one, and we've seen this in the previous panel, there was discussion of this as well, is the collection of other data that may be useful to public health authorities. And it could be data that would help them to understand the spread of the disease or where hotspots are emerging, enable them to do modeling and so on. And some jurisdictions are going to have better data than others from the start. And so in some countries or some jurisdictions, a contact tracing app that has this additional functionality might be of real use and real benefit. Another possibility is that the contact tracing app might help supplement for inadequate testing. And inadequate testing has been a problem in a number of jurisdictions. Canada is one of them, right? We've had, in Ontario where I live, for example, testing has been a big issue through the pandemic. It's starting to improve, but it has been a problem. And some apps are designed to for people to report symptoms. And there's been one app proposed in Canada, for example, that would use artificial intelligence to combine self-reported symptom data with other data to provide a risk assessment for the individual to suggest whether they either should go and get tested if that's at all possible, or should self-isolate or take other measures. And so that the supplementing for inadequate testing or inadequate resources in other respects might be another objective. And then there's a subtext, I think, with all of these, and perhaps I'm being too cynical, but in many cases, I think there's also this other possibility that adopting a contact tracing app, especially one that's locally designed and developed, can support the tech and innovation sector. And that's an interesting one as well. I mean, because it may influence what app is adopted and why it's adopted. And so it wouldn't be the predominant motivating factor, but it might be one of the factors in the mix. And so, you know, I think that we really need to think about and have some transparency about why using technology to do contact tracing is being contemplated in the first place, so that we can do proper assessment and understand that. And then we can also understand why a particular app is chosen because of its functionality that is needed to support these particular objectives.
Great, thanks for that, Teresa. And maybe just two administrative points. Again, if you can click on any box here to make it larger, either a person or the slides. And to our organizers, Vance, I still cannot see the chat, so I will need you to manage that for us once we come up to ask some questions. And the same thing for when we come to a poll, hopefully. So now, Haksoo, what we wanted to do now is, you've got some beautiful slides and very detailed slides on what has happened in South Korea. And before we sort of jump in and continue to explore these other areas, I'm going to share here a slide. And if you could just take a few moments to walk us through what's actually on that page. And we're going to come back to it every now and again as we sort of progress through this session. So here, I'll turn it over to you, Haksoo, to talk to us a little bit about what's on this slide and the approach in South Korea.
Yeah, I'll give you an illustration of what could happen at one end of the spectrum, which is to use legally mandated centralized system. In South Korea, there's privacy law, obviously, but there is a separate law covering this kind of pandemic situation, the law called Contagious Disease Prevention Act. And this whole scheme came out of this law. And in terms of the data, Korean CDC serves as a central repository of the information. So there are apps supposedly playing different supplementary roles, but what is being shown on this slide serves the main purpose of contact tracing. And this is not an app, but rather IT system, and their Korean CDC serves the key role. And what happens is, whenever there is a new patient who got tested positive, the central authority will try to find out whereabouts of this particular individual during the past several days, and also try to figure out who were in close contact with this newly tested positive. So on top, there are several sources of the information illustrated. Top left, first of all, from mobile carriers, you collect location information, and from immigration services, you get immigration records. From the police, you get footage of closed circuit TV, and from credit card companies, you get transaction data from credit or debit card transactions, and from the police, no, from public transit companies, transit pass record. And that sort of detailed information is gathered through Korean CDC. And with that information, they do epidemiological analysis and also try to contact the people who were in close proximity with a newly tested positive individual. Once they gather information, they also disseminate the information to the public. So in that respect, it's kind of two-way street. Korean CDC gathering information about the spread of the virus from the public, and then the Korean CDC disseminate the information to the public. And there are two channels of disseminating the information. One, directly by the Korean CDC, they do daily briefings in front of the press. And the other channel is to give the information to local and municipal governments. And these individual local and municipal governments, they provide information to the residents in their municipalities and localities. The Korean CDC has been disseminating the information more of a consistent manner, but localities and municipalities, although there is a guidance, individual localities have had some different standards. So there is sometimes or different standards were applied, and privacy issues were sometimes raised. So given an opportunity, I'll give an example later on.
Thank you for that, and it's really all encompassing, and it's actually quite amazing the amount of data that's collected and collated together. Maybe before we start, Vance, is it possible to have our poll?
Okay, so on the poll, there's 55-ish people who've answered it. 49 of which have said they've never used a contact tracing or the COVID-19 information sharing service, but it's only 3 who've said who've answered each of the others. So the vast majority of people have not actually used these apps before.
That's very interesting. Thank you, Vance. Okay, now the first area we wanted to come back to again is effectiveness. And you know, Teresa, let's start with you, because, you know, what are some of the key considerations when it comes to measuring effectiveness? And Pollyanna had a great slide where she had, you know, the myth of 60%. Yeah. And, you know, what from your perspective?
I'm sorry.
Option, you know, let you answer.
Sorry, Suzanne, I had a little, I don't know if other people were having the same difficulty as I was, but your audio was breaking up. But I understand the question is about effectiveness of the app. And I'm just going to start by saying that effectiveness means different things depending on your perspective. And so I think it's important to flag that, because I think it's a factor that has an impact in ultimately whether these apps are going to be successful or not. And so there's effective from the personal perspective and effective from the government perspective. And effective from the personal perspective is, you know, for many people, if they're downloading a contact tracing app, they're perhaps hoping that it is going to give them accurate, useful information about whether or not they've been exposed to COVID-19. And so from a personal perspective, then, you know, that's going to be an important factor with downloading this kind of app. And if it isn't giving them anything useful, then they're not going to use it anymore. They might take it off their phone, or they might simply just not turn it on or bother with it if it requires self-reporting or any of these other things. So there's the personal dimension, right? And in that context as well, for it to be effective, the person has to feel that it's going to do them more good than harm. And so if there are privacy issues, if there are functionality issues, if it drains the phone's battery, is difficult to use, any of these things, then it's not effective. And so, you know, there's that piece. Beyond that, there's the measures of effectiveness that we often hear talked about are the ones from the government perspective or the public health perspective. And so one of these is uptake. Now again, uptake and what is necessary, what kind of uptake is necessary, in part depends on the objectives, because different types of apps require different types of uptake to be effective. And so if you're talking about the Google Apple approach and the Bluetooth decentralized approach that we heard about earlier in the previous panel, then you need a high level of uptake, because it entirely depends on whether you have been in contact with other people who also have the app, whether you're going to get a notification of any kind. And so if you don't have a good uptake, then the app is not going to be particularly useful. If you have an app that's also collecting perhaps GPS and Wi-Fi location data, and if some of that data is being reported to public health authorities, and if part of the goal of public health is to collect data to better understand the spread of the disease and what's happening within the community, then maybe a lower uptake is still helpful, not as helpful as a higher uptake, but still there's some utility to the data that's being collected. And then if you have one of these, an AI-enabled app, for example, where you've got users self-reporting symptoms and providing other data, that even if the contact tracing part isn't particularly effective, that other data might be useful in a variety of different applications. And so effectiveness gets measured differently in that context. And so again, I think, thinking about what the objectives are, what the goals are, is important to understanding effectiveness, but it's also important to be thinking about effectiveness from the user perspective.
Thanks very much, Teresa, for that. Haksoo, from a South Korea perspective, how effective would you think the measures taken have been? And what are your thoughts on your viewpoint?
Yeah, I mean, as Teresa mentioned, depending on what kind of objectives you're referring to, with you can have different assessment. But most of all, from an epidemiological perspective, gathering all the relevant information obviously would be helpful. So there has been epidemiological benefit. That was the main effect, I would say. And the second effect was to be able to make contacts with the people who were in close proximity with newly tested positive individual. So from the government perspective, these two are perhaps two main goals that were achieved. And the third perhaps would be that by giving the information to the public, I mean, in South Korea, you get emergency alerts like maybe a dozen a day, every day through your phone. And by getting that sort of emergency messages like periodically, the general public is kind of put on notice, and that help the public being on alert of what's going on, and making them cautious on their daily activities.
So thank you for that, Haksoo. Teresa, so let's talk about effectiveness a little bit more. And you mentioned obviously the impact on privacy and from the individual's perspective. Let's dig into that just a little bit deeper. What privacy considerations do arise when we talk about these contact tracing apps?
Yeah, and there are a range of privacy considerations, and we've already heard about some of them. And so for example, there's a couple of different types of tracing technologies involved. And so if you're talking about purely contact tracing using Bluetooth, for example, that can produce what's referred to as a social graph, or it can help to profile who you spend time with, who you are in contact with, and on a daily basis. And so obviously that can reveal a great deal about you. That can be very sensitive information. And so there are privacy concerns around sharing information about who people are in contact with government. And as Pollyanna mentioned in her presentation, there are particular concerns, for example, in the US, where there have been so many protests that, and I think through poor choice of language by some police authorities, that there's an overlap between kind of digital contact tracing and police investigations into protests. So the social graph, who you've been in contact with, that's something that raises privacy concerns. There's also privacy concerns if GPS and Wi-Fi data are being used. Then there are obviously concerns about tracking of individuals, because once again, where you go on a daily basis can reveal a great deal about you. And there are concerns about sharing tracking information with government. It's interesting and ironic, and I'll just mention it, that we seem to be more concerned about sharing this information with government than we are about sharing it with the private sector, which is interesting, and maybe we should be more concerned about sharing with the private sector, particularly since the public sector can get the data from the private sector if they need to, and they frequently do. And in fact, there's been some discussion in BC about using data from the private sector, cell phone data, credit card receipt data, and other data to carry out contact tracing, because that tracking data already exists in these other areas. So that was a little bit of an aside about this. We've concentrated a lot of attention around contact tracing apps and privacy, but there's, all of this data is being collected elsewhere and is accessible in other ways as well. And I think we have bigger privacy issues than just contact tracing. That's my little aside. But I think it's also important to note that the issues go beyond just privacy, and the collection of data and the sharing of this data with government can lead to other, or can have other implications that are significant. And so, for example, some of these are civil liberties issues relating to freedom of association, freedom of expression, and so on. Some of them are going to be ethical issues. They may, the collection of data may have impacts on individuals that are, on some individuals that are more negative than on other individuals. And so if you think about contact tracing apps, and part of this is function creep as well. So we have a contact tracing app, and maybe because the situation keeps evolving and changing, maybe at some point, then the app starts being used by the retail sector or restaurants or other businesses, or even the workplace, to determine who gets to come back and who doesn't. And so participating in this scheme, then all of a sudden, maybe you were doing it because you wanted to find out if you were in contact with anyone and to protect your health and your family's health. And all of a sudden you're being told you can't come back to work, even though you need to earn money to support your family. Or you're being told that you can't get into certain stores or malls or restaurants because you haven't adopted the app, or because of information that is on the app, or how the app may have assessed you, and so on. So there may be ethical concerns about how the app evolves and what it gets used for, and how that impacts your ability to function and interact in society. And of course, we also know that some communities have been more adversely impacted by COVID-19 than others in our society. A lot of essential workers, there have been outbreaks, there's not a lot of data because it hasn't been fully collected, and this is another issue, but then there's certainly data in the United States that it has affected African-American communities more, the COVID-19, than other communities, and there's reason to believe that there may be similar patterns in Canada as well. And so the mandatory contact tracing app and the function creep may also have disparate impacts. So, I think all of these are factors that are not yet necessarily fully explored or fully understood, but they are implications for people. They do raise questions about adoption of these apps.
Thanks, Haksoo. From a South Korea perspective, I've got a couple of great slides here from you on some of the privacy issues that have been experienced in South Korea. And so I was wondering if you could share with us a little bit about the fencing team privacy issues that have emerged for those groups of individuals.
Yeah, I mean, as I mentioned, like localities and municipalities, they different localities have different policies of disseminating the information, or how granular information they'll disseminate. And in this particular incident, what happened was a group of national team fencing players participated in an international competition and came back to Korea and had their own vacation time for a few days. And local government were where these fencing team players stayed. They had a press conference, and there the city mayor disclosed this information, and which is highlighted on the right side of the slide. So these are all from the press conference. So it's about fencing players, national team. They were all female, and one of the three players was 25 years old. And it's not just fencing, but they were all épée players. And they were out of 8 members. So, they didn't give out the names of the players, but the mayor told the press this much of the information. And I did the Google search, and the homepage of National Fencing Team, there are so pages for female players and different categories. One of which is épée, and there are 8 players with photos and names. So I could easily find out within a minute who these players are, what the names are. So there are this kind of hiccups, and this took place because there is some level of competition among local politicians. Some of the politicians try to give out much of the information to the public, and they want notice from the media. So in that context, there's depending on how you see it, there's a sliding slope among the politicians. And another aspect is, say I mentioned, in Korea you get emergency alert through your mobile phone, and one of the messages was, the usual suspects of the locations where many people get tested positive would be, for example, churches or nightclubs, where many people gather together inside in close proximity with each other. And one incident, a gay club was such a place, and outside of one particular gay club, so many people got tested positive. And in South Korea, a homosexual is socially taboo, and you can easily be socially ostracized, and many of them wouldn't be able to tell their parents. And some of these homosexual people were concerned of getting in touch from the government. So they tried to hide from the public scene. So that sort of concerns were out there just because the government is gathering all the information, including location information. So in that sense, privacy aspect or ramification was so obvious.
Thank you, Haksoo. Teresa, so we've talked a lot about privacy. You mentioned function creep. whether it's public sector or private sector, also the impact on vulnerable groups. Let's delve into a little bit on some of the other considerations that both you and Haksoo have talked with me about: surveillance, especially human rights and ethics. What are your thoughts there?
Yeah, and I think that these are all really important concerns. And as Haksoo has the example he's just given is one where, through the data collected, which is the privacy concern, it can lead to significant human rights issues, right? So that that the issues of the privacy framing is also very much tied, I think, to human rights and civil liberties issues. And I think that's really something, and ethical issues as well, issues about who's going to have access to the technology. So if you think about, this is all happening really quickly, right? So, let's see if we can use technology to solve the contact tracing problem. And, what's going to be the vehicle for it? Well, we're going to use smartphones. Well, who has smartphones and who has access to smartphones? Who's going to be excluded if you adopt this? And if it is actually useful and successful, then who are you excluding? So there's sort of a range of different ethical issues. And I think that because so much attention has been focused in on privacy in the debates over, the different models and, the Google Apple model and so on, there's been a real focus on privacy. Some of the other issues have been a little bit pushed to the side or somewhat overlooked. And some of those issues link very much to privacy, so that if you don't protect privacy, then you may have excessive surveillance and civil liberties issues, and you may have human rights issues of the kind that Haksoo described. But you're also still going to have these ethical issues that kind of fundamentally go to who is going to have access to this technology, who's going to be able to use the technology, who's going to be more advantaged or disadvantaged by the technology. And some of those questions may not have been explored as fully as they need to be. I think in some jurisdictions, there's been talk about, maybe using a wearable technology for Bluetooth other than a cell phone, and making sure it's distributed to people who don't have access to cell phones or the right versions of cell phones, in order to have, a greater accessibility of the Bluetooth enabled contact tracing technology. So, so I guess all of that to say that there are privacy issues, there are civil liberties and human rights issues that flow from and are tied to those privacy issues. And then there's that broader circle of ethical issues around contact tracing.
Haksoo, why don't you spend a moment talking to us a little bit about social stigma. Here's another slide that you provided for us.
Yeah, the upper left-hand side, that's an example of emergency alerts that you get on a daily basis if you live in Korea. I would say these days you get like between 10 and 20 every day, and on some of the messages would let a newly tested positive person visited where, and on one occasion I never knew. I first came to know about the existence of, for instance, what's called public bath for men. So where homosexuals would go, and I personally, I lived in this country for forever, and didn't know that sort of place existed in Seoul. The emergency alerts in that respect give out the information that very few in the society knew that existed. And another example was what I gave, trying to find out the individuals who spend time at a particular nightclub. That sort of information could be very humiliating, at least for some group of people, or some people. The classic argument, which is, why did you visit that sort of place. If you are law-abiding good citizen, you shouldn't go out at night and hang out and just you should not go to places where there are a lot of people gathered together. So it's a classic nothing to hide argument kind of thing, and there's that sort of kind of new application of the classic debate on privacy.
Thanks for that. In the fullness of time, I'm gonna move on to the next topic, and the others will go by a little bit more quickly. But Teresa, necessity and proportionality is. I'll let you explain for folks on the line here where that's come from and how you see it impacting potentially, you know, what sort of approach we might actually adopt in Canada from a contact tracing perspective. And if at the same time you could also talk a little bit about Canada's jurisdiction in our confederation and how that might actually complicate matters for
okay, so those are two really big issues in Canada, I think. So necessity and proportionality, and the commissioners have the information and privacy commissioners from across Canada got together to issue guidance on the adoption of contact tracing apps. The Privacy Commissioner of Alberta kind of recused herself from the joint statement because the government of Alberta had already released an app and she was in the process of studying it. And so she did not join into this statement because of that. But the commissioners are advising a necessity and proportionality approach. And the necessity and proportionality approach is based in the human rights context, or a human rights-based approach to privacy. And it also is one that that we're familiar with from the charter context as well. There's this idea that you have to balance, that, you know, that there's a balance that has to be in place, that privacy is not an absolute right, it's one that has to be balanced against other public interests. And so the necessity and proportionality test provides a framework for doing that balancing, where you look at the government objectives, how necessary they are, and then how proportional the measures that are being adopted are in terms of meeting those objectives. And so it's a very useful framework and an important framework. The one concern I have about it in the pandemic context, because this is a really exceptional context, and I'm a little bit concerned about how we have approached, and by we I mean, you know, judicially, constitutionally, approach necessity and proportionality in times of urgency or times of need, which is what we're in, right? So it's an urgent time. There's a lot of uncertainty. There are a lot of unknowns. Governments are trying to do their best. Public health, the public interests are very significant. There's public health. There are concerns that hospitals not be overrun with cases of COVID-19. There are concerns about the economy and the need for people to get back to work, both for their own personal survival, but also for the survival of the economy, or the rescue of the economy in Canada. So those are all a lot of important public interests. And so for me, the big question mark is, how does the necessity and proportionality framework stand up in a time of crisis where you've got some really significant public interests facing off against those privacy issues, and where you have a lot of uncertainty and a lot of unknowns. And I think that the tendency in Canada has been to cut governments a lot of slack in similar sorts of circumstances. Now, maybe that's the right solution, but you know, but I think it's a really tricky one in this case. So that's my question mark about necessity and proportionality, is I'm not sure how it's going to play out. Now, you also raised the question about federalism in Canada, and this is I think this is a chronic challenge in Canada in a lot of areas, but certainly I think in the digital space. And so we're seeing it come up in the COVID-19 context as well. And I think it reflects also the way in which the pandemic has and responses to the pandemic have progressed. So at one point back in March, I think, for example, Ottawa Public Health was talking about adopting a contact tracing app just for the city of Ottawa, right? Because at that time, nobody was going anywhere. We were all stuck in Ottawa. The border to Quebec was closed and nobody was going anywhere. And to support contact tracing in Ottawa, maybe a public health app for Ottawa would have been a useful thing. But then, of course, we're moving into another phase now, and there's talk about adoption of contact tracing apps on a province-wide basis, and Alberta has already adopted its app. Quebec and New Brunswick and Ontario and BC have all been reported as contemplating adopting apps. And so we've got, different provinces looking at adopting apps. But the problem is that once we start easing restrictions, people are going to start moving across borders. And Ottawa, again, is a good example where we share a border with Quebec, and people travel back and forth for work, for family reasons, for all sorts of reasons. And so if you have different and incompatible apps adopted in neighboring provinces, then whatever objectives you had with contact tracing are going to be undermined as people become more mobile. And so this is a challenge, but of course, you've on the other side, you've got the Google Apple approach, which says, one app per country on this platform, which makes it challenging as well. So this is something I know that the federal government had turned its attention to trying to come up with a single app for Canada, and there wasn't, I don't think they've gotten anywhere with that. That has, I think, also slowed the adoption of apps in different provinces that have been talking about different apps. And I think in the end, we're going to come up with a bunch of different contact tracing apps for Canada that are designed by different people, that do different things, that may or may not be interoperable. And I'm sure we'll learn from that, but whether we will actually profit from those lessons, I think will be another question.
Haksoo, you explained to us how proportionality is a general government concept, but that maybe it wasn't being applied so much in this case. Can you elaborate?
Yeah, I mean, proportionality is a general and important principle whenever there is regulation or administrative decisions made. In the current context, necessity and proportionality was not such a big issue in Korea, mainly because the whole system that was put in place was had the legitimacy out of separate law called Contagious Disease Prevention Act. So generally speaking, in a normal situation, privacy law and some other laws wouldn't really allow for this detailed contact tracing system to be deployed. But Contagious Disease Prevention Act has very detailed provisions. For example, there's separate provision on gathering location information. There's a separate provision on gathering credit card transaction data. That's sort of all. There are very detailed separate provisions on for individual sources of data. So although detailed information is being gathered, just because this is done not out of the general privacy law, but out of Contagious Disease Prevention Act, and also the usual government or central authority is not a main player, but the Korean CDC is the main repository information. So the health officials are getting involved. So there's less of a concern that this whole system would be possibly used for other purposes in the future. And nonetheless, there's a requirement for example, privacy impact assessment based on privacy law, and I haven't heard of this privacy impact assessment being performed on the current system. So there's a sort of gap out there, but nobody is really raising hand and ask for that sort of information here.
Let's move on to, thanks for that, Haksoo and Teresa. Let's shift gears a little bit and just talk about transparency and trust. And I think right here, Haksoo, something you mentioned about the PIA maybe not being conducted at all in this case. We often hear people asking that if there is a PIA conducted, that it be released, at least a summary, maybe not, maybe even the full assessment should be shared with the public. So maybe Teresa, turning to you now, talk a little bit about transparency and trust, and if I can maybe pitch it this way, transparent about what, trust who, and trust what.
Yeah. So and I think trust is a big theme in Canada with respect to the digital economy, and so you see it, being talked about at the government level as, this is what we have. People have to trust. We have to build trust, and so on. So this is a big thing. It's a big theme and an important theme, and I think this is a context in which we are seeing that there's not a lot of trust capital right now, right? To some extent, the Google Apple solution and some of the choices that are made in that are ones that signal a lack of trust in government. And while it's an international solution and it doesn't necessarily reflect the Canadian context, I think it is a signal that there is a lack of trust with respect to this data. And I think that's something that's important to think about. And maybe that lack of trust is well-earned and well-deserved. In Canada, my view is that there have been problems with transparency. Understanding that things are moving again fairly quickly and decisions are being taken quickly. And there's been I think poor transparency, a lot of discussion of contact tracing apps, poor transparency about the goals and expectations of those apps. You mentioned the Alberta Privacy Impact Assessment was done but not published. The privacy commissioners have even recommended that as one of the recommendations for contact tracing apps, that short summaries of privacy impact assessments be published. I don't know why we can't have the whole privacy impact assessment, perhaps minus a few provisions that, or a few sections that might raise security issues and so on. But I'm not sure why we're so, cautious about transparency with these. More transparency about the uptake needed for success. Alberta has not publicly declared what it considers to be the necessary uptake of its app for success. Transparency about the ongoing or after the fact assessment of the utility of any apps that are adopted. So I think that there are a lot of transparency issues, I think, that relate to trust, and I don't think we've seen the level of transparency that we should see in Canada. Particularly in a context that is rapidly changing. And then, of course, there's a question about who we're supposed to be trusting. Is it government? Is it law enforcement? Or where are the trust deficits? Is it government? Is it law enforcement? Is the concern, do we trust public health authorities to do this, but we're worried about law enforcement having access or broader government having access? Are there concerns about the use of these apps in other contexts? Is that where there's a lack of trust, that the apps will be used in the employment context or in the private sector context? So, is there going to be this function creep that I talked about before? And in some jurisdictions, for example, there have been calls for separate legislation that will set out and define the parameters of where the apps can be used and not used, and for what purposes they can't be used. And then in terms of trusting what, your question about trusting what, there are things like trusting that individuals need to trust that their data that's collected is not going to negatively impact them in terms of their lives or their opportunities. Trust that they're going to be accurate enough to be useful. There's a real, with some of the apps, again, some of the apps, particularly ones that use symptom reporting and use artificial intelligence, there's a fear that there'll be, but this fear exists with Bluetooth apps as well, that there'll be false positives and false negatives. and that's going to create consternation, force people to limit their actions when it's not necessary, and so on. Trust that data will not be used commercially, trust that it will not be kept longer than necessary and that it'll be destroyed after the pandemic, and some data destroyed after 21 days or 14 days or whatever the reasonable period is. So I think there are a lot of issues that relate to both privacy and trust that need to be addressed with respect to these apps because of the potential implications that they can have for people.
Thanks, Teresa. Haksoo, I'm going to bring up another slide that you'd shared with us. And if we sort of talk about being transparent in what data is collected and how it's used, here's a slide you prepared that sort of shows the data points that are collected, but also disclosed. And so could you talk a little bit about, it's one thing to collect it, but what data is actually disclosed? Can you talk to us about what's on this slide and what you've seen in South Korea?
Yeah, I mean, you know, transparency in the abstract is a good term. You know, everybody think it's good to have transparency, but transparency could have different meanings in different contexts and different countries. This COVID-19 context in Korea, transparency mainly means, I think, speedy collection of the information and also speedy dissemination of the collected information to the general public. I mean, sharing with the public, that doesn't necessarily have to be giving out detailed granular information to the public, but at least some localities and municipalities, they seem to compete against each other, trying to give out detailed information. So Korean CDC does its daily briefings. At the same time, Korean CDC gives out the information to the localities and municipalities, and local politicians, they don't really have to give detailed information, but some of them apparently believe just passing on the detailed information they get from the CDC to the general public, that's good for the public or good for their political, who knows. So in Korea, you know, you get this depersonalized information with no names, but you get, as you see on the screen, you get age, you get gender, you get itinerary of the movements during the past several days. You know, that sort of information is typically given out to the public. Some localities do not give out that much of information, just somebody in their 20s or in their 30s, and without giving specific locations. But you know, different localities have different policies. So in that respect, sort of competition among local politicians was one of the issues that we had to deal with in terms of dealing with privacy implications.
Thanks. We had a fourth area that we wanted to explore, obviously, for Ken and de-identification and other privacy enhancing technologies. We heard a little bit about that from Dan and Pollyanna before, and but I think maybe in the fullness of time, Vance, maybe I can ask, we could maybe take one or two questions in the chat if there are any before we end the session and give folks a couple of minutes before the next one. Anything, Vance, that you've seen in the chat? Well, I think with that, I don't know what happened. We're at 12:14. We had till 12:15. So I suggest that we take a break now for 2 or 3 minutes before we start the next session. Thank you, Teresa, Haksoo, for your great insights. Don't forget to leave the session, press the leave, go back into the sessions button and find and join the next session with our regulators.
Thanks so much.
Thank you. Thank you very much, everybody.
Thank you.